now.
Thanks for joining us on air and streaming live on our News 4 app. They were supposed to be among the very first to be tested and get results.
But tonight, healthcare workers tell News 4 Investigates they're having to wait weeks to find out if they have COVID-19. Let's go live to our chief investigative reporter, Jeremy Finley, who's been talking to these healthcare workers.
Jeremy, what are they telling you about how long they're waiting?
Well, Tom, we've been telling you about the delay in test results for people like you and me. But overnight, I started hearing from doctors and nurses, people who should be at the top of the list, according to the state, for getting those test results the fastest. What we are being told from these healthcare workers, they've waited at least 2 weeks and still don't have their results.
If you wonder what it's like to talk to a nurse with coronavirus symptoms,
we understand that.
Meet Judy McCrae. 2 weeks after getting the test, she still doesn't know her results and can't go back to work at her hospital.
I think they were very surprised that it's taken me this long.
And listen to this phone call from Lindsay. She's a nurse too, and asked us to protect her identity.
We went straight from work in our scrubs with masks and gloves to the walk-in facility.
She and her doctor husband have been quarantined for 14 days and still don't have their test results.
You have to think of how many people that my husband and I came in contact with, not only patients, but also our coworkers that we could have potentially infected, that still don't know if they have been infected.
Because you don't know if you were.
Have no idea.
They are among the healthcare workers frustrated that they had no idea what News 4 Investigates first reported yesterday. The state public health department's lab can return test results within 24 to 48 hours for healthcare workers. But no one ever told healthcare workers to ask that their tests be sent there. Instead, they went to walk-in clinics using internal or private labs and are now caught up in the backlog of test results with other people. Representative Mike Stewart has been critical of the state's plan for testing healthcare workers.
There's not a clear system for getting tests of critical people like healthcare providers, first responders tested rapidly so that they can get back to the front lines.
Is there a concern that healthcare workers are having to wait so long for their test results? News 4 Investigates asked that question to the governor and the commissioner of the Department of Health.
We're aware that test turnaround time is particularly challenging for us with healthcare workers, and the challenge that we need so many healthcare workers is the reason that we're pushing hard for these quick throughput tests.
Obviously, we don't have the capacity to run all of the tests in Tennessee, and so the large percentage, as you can see in the data on our website, are run by private labs.
Okay, speaking of those private labs, Vanderbilt tells us that they are working through their backlog. So many of those walk-in clinics are through Vanderbilt. They tell us that they're working through their backlog, trying to get as many of these cases out. Now, of course, knowing that healthcare workers are in that backlog. Guys, back to you.
Interesting information, Jeremy Finley. Thanks so much.